And it's like, you drop off all the weight and you start noticing you're getting big again. Do you have to get more adjustments?
Absolutely, you got to get that. You got to get the tires filled once in a while. So,
because we know somebody that had this done, and he had dropped like 185 pounds.
Wow.
In about a little over a year's time, and just lately it's just starting to get some of it back.
Yeah.
So that might be.
Well, on the band, there's some adjustments to get to the right spot. It's individualized for you, and then once you're there, you're good for a long time. For example, we just had a lady come in who hadn't had adjustments for 2 years.
And it's no biggie to make the adjustment.
No,
obviously, it was just
simple. Yep, straightforward.
It would probably cut the heck out of my liquor bill too.
That's right.
Because I do happen to know someone who's got one of these, and about half a shot of alcohol. Man,
is plenty.
Party. Then about 3 minutes later, just dead sober.
So in other words, this would pay for itself at some point.
Yeah, right. Yeah.
Just making sure I understood that.
You said the insurance companies are getting a little bit. They're very cautious about who gets on this, who is made available to. I'm sorry, I'm having a difficult time formulating a sentence this morning. But the obesity is one of the main requirements, right? Mm-hmm. At what point does an insurance company see that it's going to be saving them money down the road as opposed to doing nothing?
Well, we have lots of good studies now that show once folks are heavy, doing this operation saves money for the insurance companies, and the payback is fairly quick. It's in a couple of years.
Okay.
So we know that for a fact.
So they can get them off the drugs. They can get them out of the doctor's office.
Get them out. Get them off of 5 medicines. Get them out of no more doctor visits. They're going. Some of my patients go to the doctor visit once or twice a week. You got the pulmonary and internal medicine and endocrinology and the back doctor, and you can get rid of all those guys. So the payback is fairly quick for the insurance companies.
That's amazing. Can I ask approximately what is the cost of an operation like this?
These operations typically cost, the band is typically around $15,000, and the bypass is around $20,000.
Okay.
So it depends on who you go to and where.
Now, the band just seems like the deal, though, to me.
Yeah.
It really does. I mean, obviously I don't know why I'd be far more comfortable than bypassing my stomach completely.
But I like the band because it's the safest one we have. I like it because it's reversible. Like you said, if everything goes to hell in a handbasket, we can just pull it.
Are you doing a lot of these now?
We are.
Yeah?
We are. Yeah, we do mostly bands, by the way. We do about 80% bands for those reasons. People have a comfort level, knowing that they can take it out, knowing that it's adjustable, knowing that it's reversible.
And you're saying within about a week they'll be back to work?
It depends on the person. Of course, we got, some folks that I've actually had patients I've operated on laparoscopically.
Right.
And I discharged them home from the hospital, and they didn't go home.
Nuh-uh.
Yeah, they did not go home. They went to work.
So generally speaking, there's not a lot of pain involved. I mean, generally they should go home and rest, obviously, to make sure everything's right. But there's not a lot of pain that's involved in this.
No, this is
not. Small incision.
It's not a painful surgery like a knee surgery. Very painful. It takes a long time to recover. The pain, like I said, you cut yourself bigger than that in the kitchen, I'm sure. Or when you're a kid, you skin your knees bigger than that.
So there's
small cuts.
No pain from the band while it's on your stomach. I mean,
No.
You don't know that it's other than the fact you should be getting full quicker.
Right.
Wow. So if somebody's interested in this, what would you recommend? Just giving somebody up at the hospital a call?
Yep, you can give us a call at the hospital, at Desert Springs Hospital. You can look up online at blossombariatrics.com.
Okay.
But more importantly than that is do your homework. Talk to friends that have had it. Ask them what they like about it, how they're doing, what problems they're having with it. Go online. There's a huge support available online for people considering this. I can't believe everything you do online. Read online, obviously, but do your homework, do your research, explore, ask lots of questions, and that way when you come to see me, I'll just be able to help you that much more.
Right. Well, I can't tell you how much I appreciate being here because this was a big mystery to me, and I had no idea how this whole thing worked. And I don't think I'm going to be a candidate for it. I'm going to the gym a couple times a week trying to get some of this weight out. But there are others that are not so fortunate as I, and maybe they're immobile with possibly a bad leg or something. They can't get out there and exercise. And that would be a good candidate, would it not, for someone who is
Oh,
impaired in
absolutely.
that regard?
Yeah, no, that's why I love to see people come in wheelchairs, and 6 months later they're walking in the office. That's
Oh,
what I love
sweet.
to see.
Excellent.
Yeah,
Will you come back and see us again?
absolutely.
Thank you
Yeah.
very much for being here, Doctor.
Oh, thank you.
Sam, we're going to go ahead and close up the show.
Okay.
All right. I want to thank each and every one of you for watching today. We do appreciate it. Gary, see you again tomorrow.
Thank you. Nice to meet you, Doctor.
Likewise, thank you.
Sammy, thank you.
You are welcome, and thank you, Doctor. I will look into it a little bit more.
Just
Very good. Johnny, thank you, sir.
Thank you, young man, and doctor. I'll make sure he looks into it some more.
Each and every one of you, Desert Springs Hospital, Dr. Umbach, and give them a call up there. They're in the business, so check them out. We'll be back again tomorrow with more of the morning show. Please join us then. Until then, have a safe day. Bye-bye.